Here are your discharge instructions following your cardiac catheterization. The catheter was inserted into your groin and was carefully guided up into your heart. Once it reached your heart, the catheter was placed into two different arteries that delivered blood to your heart. The contrast dye was injected. The dye allowed your doctor to see the areas of your coronary artery that had blockage or potential blockage. If you had blockage, you have had what's called an angioplasty and a stent placed into your heart. What to expect at home. You may feel some pain in your groin where the catheter was replaced. What to expect at home. You may feel pain in your groin where the catheter was placed. You may also have some bruising in the area where the catheter was inserted. In general, people who have an angioplasty can walk around within 6 hours following the procedure. Complete recovery takes a week or less. Keep the area where the catheter was inserted clean and dry for 24 to 48 hours. Walking short distances on a flat surface is okay. Please limit your going up and down stairs or any strenuous activity for the first 2 to 3 days. Do not do any yard work, do any squats, lift any heavy objects, or play sports for at least 2 days or longer if the doctor has told you differently. You will need to take care of the incision in your groin. You will need to change the dressing in your groin at least twice a day. This will have been shown to you by your nurse. If there is bleeding on the incision area, then please lie down and use the gauze that was presented to you and to put pressure on the groin area for 30 minutes. Many people take aspirin or other medicines such as Plavix after this procedure. These medicines are what we consider blood thinners, and they keep your blood from clotting or from forming clots in the arteries in the stent. A blood clot can lead to a heart attack. So, if the doctor has told you these medications to take following the procedure, you must do exactly what your physician has told you. Do not stop taking any of these medications without talking to your doctor. You must do exactly what your physician has told you. Do not stop taking any of these medications without talking to your doctor first. As always, you want to eat heart healthy, you want to exercise, and you want to follow a healthy lifestyle. Your doctor can refer you to other healthcare providers who can help you learn about exercise and healthy foods that will fit into your lifestyle. When do you need to call the doctor? Please call your doctor if any of the following. There's bleeding at the catheter site that does not stop when you apply pressure. There is coolness or numbness below the area of where the catheter insertion was. If the small incision where the catheter was placed becomes red or swollen and painful, or if there is a discharge that's a yellow or green in color, then you need to call your physician. Additionally, there is coolness or numbness below the area of where the catheter insertion was. If the small incision where the catheter was placed becomes red or swollen and painful, or if there is a discharge that's a yellow or green in color, then you need to call your physician. Additionally, if you have any chest pain or shortness of breath that does not go away with rest. If your pulse feels irregular or it feels very slow, please call your physician. Additionally, if you have any dizziness, fainting, or feel very tired. If you're coughing up blood or yellow or green mucus, if you have problems taking any of your heart medications, or if you find out that you're having chills or a fever above 101 degrees, again, please call your physician. What about post-compression?